The drug-resistant TB crisis is mounting, yet the old and toxic drugs are failing to deliver. A new treatment regimen is urgently needed, and after half a century of neglect, the chance is finally here.
Whether the tablets make me sick or not, I must take them each.
Every time when I have to swallow this, it is just, a trip to hell, but what to do? To live, I have to do this.
दवा खाए 2 महीना 3 महीना दवा को देख के इतना गुस्सा आता है क्या इतना दवा रोज रोज खाने का.
For a chance of cure, patients must take around 15,000 pills.
Это лекарство мне влияет и на зрение, и на слух, и на память.
अभी इतना वो दवा से इतनी साइड इफेक्ट होती है कि कमर के जॉइंट दर्द, पैर में दर्द, बाल निकल जा रहा है.
Endure 8 months of punishing daily injections.
Some patients will develop depression. We've even had patients commit suicide because of the treatment.
For 2 long years.
If we follow international best practice guidelines, then we actually get 54% success rate.
We're down to levels of 1 in 2. We're flipping a coin almost and who gets cured. And this is clearly unacceptable.
क्यों हम लोग इसमें इन्वेस्ट नहीं कर रहे?
Our patients are suffering, our medical staff is distressed, and as the epidemic grows, the cost of inaction is mounting.
The cost of the drugs alone for MDR-TB is around $3 billion a year. Think about that, $3 billion a year. And on top of that, we have to pay for other costs. We have to pay for the long treatment period, the hospitalization, the management of the awful side effects that we see. This is something that's clearly not going to allow us to scale up treatment to a level we need to meet this public health problem.
What we need today to bust the epidemic of drug-resistant tuberculosis is a treatment that is short, less toxic, and more affordable.
After nearly half a century of neglect, the wait is finally over.
Today we have a historic opportunity. The TB drug pipeline is the best it's been in the last 50 years.
2 new drugs have been registered and others are in development. This is an important step forward, but individually, no one drug is the answer.
We need to see these drugs being put together. We need to see new regimens being developed. We need something practical coming out, not just new drugs. We need real treatments for patients.
The time is now to push on and develop an optimal treatment regimen to find the best, shortest and most effective cure for patients.
मेरी रिक्वेस्ट है कि इससे अच्छी दवाइयाँ देवे और इससे अच्छा इंजेक्शन जिसमें इंजेक्शन नहीं रहेवे और खाली दवाई रहेवे.
Я бы хотела, чтобы улучшили именно вот эти лекарственные препараты, чтобы они были лучше, чтобы у них было вот эти побочные действия меньше.
Please, let us get into something which is short and really effective with less of side effect.
A new treatment regimen is the giant leap necessary to tackle this global crisis.
We have to seize this opportunity. We can turn this epidemic around. We need to step up. We need to deliver.
The dream of having shorter TB treatment for multi-drug resistant TB, the dream of having treatment that doesn't need injectables, and the dream of having treatment that is better tolerated, has less side effects, is at a point where we can make it a reality.
What is coming out is revolutionary for TB. And I think we have a moral obligation to do better. And that we have a moral obligation to really tackle this problem because we have the ability to do so. Because we can, we must do it.